Bipolar disorder is a chronic mental illness that affects a person's mood, energy levels, and ability to function. It is marked by intense mood swings that range from manic highs, where a person may feel overly energetic, euphoric, or unusually irritable, to depressive lows which bring feelings of deep sadness, fatigue, and hopelessness. These emotional shifts are more severe than the normal ups and downs everyone experiences, and can significantly interfere with daily activities, relationships, and decision-making. Although the exact cause of bipolar disorder is not fully understood, a combination of genetic, biological, and environmental factors is believed to play a role. The disorder often appears in late adolescence or early adulthood and can persist throughout life if left untreated. However, with the right medical care, therapy, and lifestyle adjustments, many individuals with bipolar disorder can lead stable and productive lives. Raising awareness and promoting understanding of the condition are essential steps toward early diagnosis and reducing the stigma that often surrounds mental health issues. Here are some types of bipolar disorder. Number 1, bipolar I disorder. It is one of the primary types of bipolar disorder and is defined by the presence of at least one manic episode. A manic episode involves a distinct period of abnormally elevated, expansive, or irritable mood, accompanied by increased energy or activity levels. These episodes typically last for at least a week and may include symptoms such as inflated self-esteem, decreased need for sleep, rapid speech, racing thoughts, and impulsive or risky behavior. In many cases, a manic episode in bipolar I disorder is preceded or followed by periods of depression or hypomania, a less severe form of mania. Depressive episodes can involve persistent sadness, lack of interest in activities, fatigue, changes in appetite or sleep, and thoughts of worthlessness or suicide. The transition between manic and depressive phases can happen suddenly and unpredictably, making the condition challenging to manage without proper treatment. The severity of manic episodes in bipolar I can be extreme, sometimes requiring hospitalization to ensure the individual's safety and to stabilize their mood. Untreated mania can lead to serious consequences, including damaged relationships, financial problems, and legal issues. With a combination of medication, psychotherapy, and lifestyle management, individuals with bipolar I disorder can reduce the frequency and intensity of mood episodes and lead balanced, fulfilling lives. Number 2, bipolar II disorder. It is a form of bipolar disorder that involves recurring episodes of depression and hypomania, but not the full-blown manic episodes that define bipolar I disorder. A major depressive episode in bipolar II is typically more persistent and disruptive, often including symptoms such as prolonged sadness, loss of interest in daily activities, changes in sleep or appetite, fatigue, and feelings of worthlessness or guilt. These depressive episodes can be deeply debilitating and are often the primary reason individuals seek treatment. Hypomania, the other key feature of bipolar II, is a milder form of mania. While individuals may experience elevated mood, increased energy, and greater productivity during a hypomanic episode, these symptoms are not as extreme or impairing as full mania. In fact, hypomania may sometimes be perceived as a period of improved functioning. However, the shift between hypomanic and depressive states can still significantly affect daily life and emotional well-being. A major challenge with bipolar II disorder is that it is often misdiagnosed as major depressive disorder due to the subtle nature of hypomania. As a result, individuals may not receive the mood-stabilizing treatments they need. Proper diagnosis through careful psychiatric evaluation is essential for effective management. Treatment often includes a combination of medication, such as mood stabilizers and antidepressants, used with caution, along with psychotherapy and lifestyle changes to help manage symptoms and reduce the risk of mood episode recurrence. Number 3, cyclothymic disorder, cyclothymia. It is a milder but chronic form of bipolar disorder. It involves frequent and alternating periods of hypomanic and depressive symptoms that persist for at least 2 years in adults or 1 year in children and adolescents. However, these symptoms do not meet the full diagnostic criteria for a hypomanic or major depressive episode, meaning they are less severe but more persistent and unpredictable over time. People with cyclothymia often experience noticeable shifts in mood, energy, and behavior that can affect their daily functioning, though not as dramatically as in bipolar I or II disorder. For example, during hypomanic periods, a person may feel unusually energetic, confident, or irritable, while depressive periods can bring low energy, sadness, or disinterest in activities. These mood changes are less intense but can still disrupt relationships, work performance, and overall quality of life. Diagnosing cyclothymic disorder can be challenging because the symptoms often seem less serious or are mistaken for personality traits or stress responses. However, without proper treatment, cyclothymia may increase the risk of developing full-blown bipolar disorder over time. Management typically includes mood stabilizers, psychotherapy, and lifestyle adjustments to help individuals recognize mood patterns, reduce emotional instability, and improve functioning. Early diagnosis and consistent care can significantly enhance long-term outcomes. Number 4, other specified and unspecified bipolar disorders. These are diagnostic categories used when a person exhibits symptoms of bipolar disorder that do not fully align with the specific criteria for bipolar I, bipolar II, or cyclothymic disorder. These cases may include mood episodes that are shorter in duration, less intense, or have an unusual combination of features. For example, a person might experience rapid mood shifts that don't meet the required time frame or severity for a formal bipolar diagnosis, yet still face serious challenges in daily life. These classifications allow mental health professionals to acknowledge and treat individuals who experience significant mood instability and impairment, even if their symptoms are atypical. People in this category may still suffer from cycles of elevated and depressive moods, leading to difficulties in relationships, work, or self-care. The flexibility of this diagnosis helps ensure that those who are struggling are not overlooked simply because their symptoms do not match standard patterns. Management of other specified and unspecified bipolar disorders often follows a similar approach to other bipolar types, with a focus on mood stabilization through medication, therapy, and lifestyle support. Since these cases can be more complex or ambiguous, careful monitoring and personalized treatment plans are essential. Early recognition and intervention can help reduce symptom severity, prevent worsening of the condition, and support long-term emotional stability. How can we manage these disorders? Here are some ways of management. Medications play a central role in managing bipolar disorder by helping to stabilize mood swings and prevent episodes of mania and depression. Mood stabilizers, such as lithium, are often the first line of treatment and are effective in reducing the intensity and frequency of mood episodes. Antipsychotic medications, including drugs like olanzapine or quetiapine, may be prescribed when symptoms of mania or mixed episodes are severe